So my name is Raj Shah. I'm the host for this afternoon's panel and also the moderator. So we have a very interesting and a panel with a broad set of experience, very appropriate for our topic this afternoon. Okay, I'll start with my background. I've been in the Valley many years, been between startups and large companies, been founder of 3 companies and co-founder in a few others. Also been in large companies. My significant big company achievement was building maps. If you use maps on your phone, Google Maps, my team built all that data worldwide. I've also headed maps at Microsoft, also consulted with Apple. And I've just founded a company that's going to focus on computer vision, AI for the defense marketplace. Patti, introduce yourself, see if that's working.
Thank you, Raj. I'm Patti White, and I'm the CEO and co-founder of a company.
Make it louder, please.
Company called Hemex Health. We're actually up in Portland, Oregon, so if you want to hear about Portland. I was in the Bay Area for about 15 years, but we escaped just to go up for the rain. Anyway, what Hemex Health is working on developing some breakthrough diagnostics for malaria and sickle cell disease. So our goal is to really create technology that could go out to the lowest level healthcare worker, and we've got a 1-minute, $1 very highly sensitive malaria test, and also an 8-minute sickle cell and thalassemia test. So that's what I'm working on right now. So it's a hardware product. It's a diagnostic device that's small and fits in your hands and portable. And my background really is 22 years in medical devices, so a lot of hardware, patient monitors, pain medicine devices, cardiology devices. And before that, I worked in the personal computer business back when it was first starting. So, really hardware related, but through lots of different business models, a lot of lessons learned, some great successes, some great failures. So happy to share any of those.
Hi there, everybody. So my name is Ankur Srivastava. I'm the CEO and co-founder of a company called SwarmSales. And let me ask you this, how many of you guys are entrepreneurs? And at what point at some point will you guys need sales for your product? Okay. So as you can figure out with the name, SwarmSales is basically solving the problem of sales. And we're doing it in a unique way where the traditional route is having to hire a recruiter, then go and interview a bunch of sales reps, then bring them on board and actually start then selling, which takes anywhere from 3 to 6 months. We changed the game a little bit by actually creating a marketplace that allows you to now come on, activate top tier sales reps, and then start engaging in your accounts instantly. And we curate the entire experience after you've been matched with the seller from introduction all the way to close. And today on our marketplace, we have we launched in January, but since then we've aggregated about 770 sales reps, and today we actually have an active 100 companies selling on the marketplace. So.
Good afternoon. My name is Sanjaya Kumar. I'm actually a doctor or a cardiologist by training and an accidental forced healthcare IT entrepreneur. Didn't intend to be a healthcare IT entrepreneur, but got into it. I had a very successful healthcare IT company that focused on improving the way that hospitals monitor quality of care delivered to their patients and patient safety issues, as well as compliance. Grew that company over a period of about 10 years into about 2,300 hospitals in the U.S. And we exited to a private equity firm in 2010, and post that, we founded a business accelerator that primarily focuses on younger healthcare IT companies to help them scale in the market. Our key focus or key areas of interest from a business accelerator standpoint are literally the areas that perhaps other companies tend to overlook. Administrative kind of things that are still a big burden and still a cost within healthcare. Believe it or not, we spend 60% of our healthcare dollars on administrative overhead, and also on coordinated, connected care models.
Business models have evolved quite a bit. I mean, it was in the old classic manufacturing sense. You build something, there are a cost of manufacturing, There was cost of distribution, cost of sales, and you had gross profit margin. But the new business models are there are lots of different ones, and in this the sales pricing has also been getting creative. In fact, this morning I heard something about there are companies that are now doing pricing based on ROI. So would like your perspective on how you've seen business models evolve in your vast experience. Anyone want to start?
Sure, I don't mind. So today, an interesting paradigm shift is taking place. Much like what cloud did for data center, we're seeing sort of a modularization of services occurring. You kind of saw snippets of it over time. LegalZoom was a great example of it. There was TriNet, Zenefits for HR. And now what we're seeing is essentially the same thing happening across sales. We're trying to do that. Legal, finance, engineering with Gigster. And so today, you as entrepreneurs have an advantage because you actually can build great ideas and start leveraging all of these resources incrementally. Versus yesterday, you would have to go hire these people, and you were really handicapped from building your products. So the evolution of today is you actually have an opportunity to build a great product and start leveraging incremental modules. And as you start becoming more dependent on it, then you can start thinking about investing it. But we're seeing that from at least our perspective. And our goal personally from a sales perspective, if I may, is to say, if you're a company today, you are sitting over there, you're thinking about eventually taking your product to the market once it's completed. What my advice to you is, the moment you have 50 to 60% of your product completed, let's engage your end clients, because those end clients are gonna completely revamp your product. So instead of you having to go back to the drawing board and rebuild that product, let us work with your end client and co-build your product. You're going to have a much higher success rate.
For us, when we think about business models, I'll take a good example from the company that we actually started. Believe it or not, we were the first company that ended up becoming a software service model for healthcare in the cloud, right? But initially, when we started our company, we didn't think about it being a SaaS-based business model. We actually thought of it as the traditional software licensing and support model, because that's literally what was the norm. We had to shift, and we ended up pioneering the SaaS model for healthcare in the cloud. For us, when we look at a business model, even for companies today, it's a rough guide for us to know how the folks are actually thinking about in terms of go-to-market and really how they're going to make money off of something. Clearly understanding that that is actually literally going to shift and change over a period of time based upon how the market influences the adoption.
Thinking about your business model and how it really connects to the value that your end customer really really values, or where they really put the emphasis is really important. For example, for us, as we were kind of thinking through, it used to be years ago, most of medical equipment, it was capital equipment. People thought about, spending a lot of money on this big piece of capital equipment. And that's, really gone away to some very large extent. And people now are more looking to business models in medical is, do you have a disposable or something where you can generate a revenue stream from each piece? And we're really trying to go one step further, because we're really trying to get out in the low end of the market, where we have a reader component and a disposable, but we even created a business model where you could amortize. If you just buy enough disposables, we'll give away the reader, because really what we want to have is as many socket opportunities that can be out there as possible. So, you can really see in many industries how the whole business model idea has evolved significantly, and you almost have to kind of track what's going on in other areas, because you may start off with one business plan and you may need to change that because the market's changing, as you mentioned, Sanjay.
So what are easy things to miss in terms of when you think about a business model?
I think this distribution part is key, and that's why I think Ankur should talk about it, because that's the thing that can kill you in the end, is getting your product all the way out there. And it's not just sales, it's marketing also.
Yeah. I just want to augment, maybe tweak a little bit what Sanjay just said. I think you have to have an open mind to your approach. While you should look at a process that exists today that that you're trying to improve, just know that the customer base is already dealing with problems that are going to evolve your product drastically. And I think from that perspective, a little bit of that flexibility should be warranted, and you should be expecting that. But you're absolutely right. I mean, the distribution channels will open up a lot more opportunities and use cases that you haven't thought about. And at that point, you can figure out which ones are the repeatable one and invest in those instead of everything.
So let's get, you want to add something?
So
Okay.
just adding, so when you say what do most people miss, a lot of the business models and the forecasting that is actually done within those models, I feel are actually built in a vacuum without a very good understanding of the market or the penetration that they can literally get in the market by introspecting with the customers. Developing a forecasting model for your business model has to be done with the customer and together with the market needs identified clearly. And most of the time, they're all theoretical.
So let's get a little bit deeper. And if you can respond with some specific examples of your current company or prior
Sure.
company. The term unit economics comes up a lot. So what does that mean to you, and how did you apply that?
It all depends upon what you're selling, right? I
Okay.
mean, in the case of Patti, for example, they're selling a disposable.
Yeah.
That actually goes in. For us, we're basically selling a software. All of our applications that our companies actually, even the companies now that we actually develop through our accelerator, they're all SaaS-based platforms. So they're all selling a cloud-based application on a SaaS-based model. Most of them are actually on an annual recurring. So we have a company, for example, that actually sells a very comprehensive document control management system for managing, let's say, policies and procedures or contracts within hospitals. So we sell a module, and there's a fee that we actually literally charge per FTE, per full-time equivalent of a hospital. So if a hospital employs, let's say hypothetically 3,000 people, there's a fee of $10 per FTE per year that is applied to that, so you get $30,000 for that particular module from that hospital. So that would be an example from our side.
Yeah, there's actually a saying that that business models came about around the same time that spreadsheets came about. So I don't think we could figure them out before then. But it is kind of worth really figuring out, especially if you're doing a hardware product, which obviously is more my perspective, of all the steps that it really takes, to really get the whole value chain of what it takes to get to your customer, and really thinking about, how can you make each step of that value chain not only work for you economically, but then also really create the motivation at each point in that step so that you can be successful. I mean, I've done a lot of startups, and I've worked also from the big company side where I made partnerships with startups. And what you often saw that along that chain, there would be somebody in there that didn't have the right motivation. Either a manufacturer that didn't really want to do your product, so you got put on hold, or a sales rep that maybe, your product was missionary, so they weren't going to spend a day telling a doctor about it when they could just be an order taker, and make more commission. So I think looking at not only the economic side, but the motivation side is really important.
In our case, since we're aggregating companies, we actually get to see quite a few of these dimensions. And one of the things that we're focused on, like you just mentioned, Patti, is on one aspect of that journey for the customers, which is how do we just improve their sales and drive that cost down drastically by aligning them with the top talent, but for cheaper. And what we're trying to do is sort of improve that process of how a company is essentially getting in front of their clients and essentially closing that deal, but doing it for cheaper, right? So what that means to us is if we're basically tracking the unit price in accordance to a company's growth, then now a company can take that money and reinvest it back into engineering and not have to keep spending it on just trying to figure out if a target market is accurate or not for them.
All right.
Quick introduction. I'm Raj Ramaswamy, founder, CEO of Shop & Sync. Our company provides it's a platform for building assistive technologies for primarily commerce, but other verticals. So it's something you can use to drive conversions as platforms like Facebook, Google, and others move there. So we have initial customers, we have a baseline of pricing, go-to-market, etc. So I think the question, and I'd love to hear each of your perspective on, very closely related to business model is the pricing question, right? So, what's your perspective and journey of where did you start the pricing, and more importantly, how did you kind of evolve the pricing, to understand whether you've been overpricing it, underpricing it, for what sections, and what has that journey been like for you, and what can we kind of take away from that? Thank you.
I think that question is perhaps one of the most important questions that any one of you could have actually asked, and is very pertinent. The fundamental underpinnings of that literally is, do you clearly understand what it costs you to actually produce that particular product, right? The cost, and what does it take for you to actually sell that product? Most entrepreneurs or most early stage companies literally don't have an answer to that, right? So it's very, very important to understand that and base your pricing on based upon that. So let's take the example of our company, right? When we looked at the competitive landscape of this company, and I'll use the same example so that I don't have to introduce others, the policy management software. Why did we arrive at $10 per FTE? Well, we looked at the competitive landscape that was, first of all, there. The nearest competitor that was there to us, that was already in the market, although they didn't have a superior product to what we had, they were actually selling at a much higher price than us, for about $15, right? We had other competitors that were nowhere close to us, but they were much smaller. They were selling at much less. We just put ourselves in the middle bracket in order to basically gain market share. But even at that point when we did so, we didn't clearly understand what it was going to actually cost us to sell that product, plus how long would we have to keep that client in order to basically make a return on it, right? Those economics actually came later, and now we have determined that we literally have to keep that hospital for about 1.5 years before beginning to make money on them, right? So our attrition rate has got to be really, really low. And it is. Our attrition rate is like 0.001.
But in your case, you're lucky. Your competitors where you could compare your pricing with.
Right.
But often there's a new model like your model.
Yes.
Yeah.
How do you know what competitive price is? Yeah.
That's a very good point. We initially kept it free, right? In the sense that there was no cost for onboarding. And we let the journey kind of determine what points were priceable and which ones were going to be experience related, and we were just going to be amazing at being customer success focused. So for the first, our company launched in September, and from September to December, we didn't price to get on the marketplace. And I call that our learning. We paid the customer to teach us. Once we knew what were the valuable pieces, then we started turning up modules that we knew we could price upon. And even the actual mechanism of the marketplace itself, where the interaction happens between companies and sellers, we had anchored on something, but we wanted to see if the companies or the sellers could convince us that we were priced wrong. But because we were defining a market, we had to put sort of a stake in the ground. Now, with that said, now we've learned, and there's a pricing model that exists. We're a hybrid. We're SaaS and a marketplace, right? Because we're serving a purpose. So we're kicking up sort of a pricing model that makes sense. But I'm keeping in mind every single day, as our CTO will tell you, that at no point could we have churn with this model. So we need to make sure our customers are happy. The other piece is that the barrier to entry has to be low for these companies. And the big one is that there's a stickiness on the product, right? So they continue to stay dependent on the product. So those are the variables that we take a look at and kind of build an equation, and we say, okay, can we start pricing based on that?
And did you at any point consider, Mr. Sanjaya was making about cost and margins?
Can you take the microphone, please?
Yeah.
No, let him follow the follow-up.
The beauty of software is, you have a lot of margin to play with. Now, with that said, we looked at it once again from a customer success perspective, and the acquisition of the seller perspective. So we knew there was a minimum amount that we need to hit to be able to continue attracting the top sellers and investing in marketing and customer success. And that's what we anchored on. We're still on the journey of delivering value to our clients. And when we know that we've maximized that value and now it's repetitive, that's when we'll go to the next level of our pricing model.
I'm Raj from Blue Green Networks. I have a simple question. You touched upon the topic of unit economics.
Yes.
That keeps on coming. As an entrepreneur, do you have some kind of a template where we can look at some place where we can fill the different values for our own specific need? Based on your experience, is there some place where we can, like, is there a Y Combinator or something where, like a safe?
So let me understand. You're talking about, is there perhaps a tool that you can actually use that can allow you to put in your assumptions? And
It's a
build
guideline. It can be a guideline
Or a
document.
sample Excel worksheet.
Right, right.
Yeah.
So actually, believe it or not, based upon some of the work that our accelerator did and from my past experience, there's a gentleman at TiE, he's also a charter member, he's launching a new company called Sequence, SEQNC, which does exactly what you're basically talking about. And it will help you literally understand not just the unit economics, but build out the models and then the what-if scenarios on top of that.
If I can add one more thing, one of the things, so CMO of Atlassian is on our advisory board, and one of the things that he did was he actually came out and spent a day with us in helping us dissect every one of our business process. And we built our flywheel. I'm not sure if you're familiar with the concept of a flywheel, but a flywheel is basically from the moment you onboard a customer to the moment that customer actually achieves the goal of closing a deal on your marketplace. So we actually dissected every one of those pieces out. And then we associated percentages and assigned sort of a metric that we were measuring against every one of those compartments that we developed. And what that gave us more than unit economics was our business levers, right? It gave us the opportunity to see if tomorrow in our customer's journey they ever got stuck, and they got stuck in a particular division, we knew what we needed to do from a marketing perspective to turn up that or fix that bottleneck and grow it. And so I would say the unit economics are a good piece to take a look at. But out of all you entrepreneurs over here, if there's a one piece of advice that was an aha moment for us, was build out your flywheel. And we happy to share a template that you can customize for your own business. But take a look at your business from start to close. And once you get to that point, dissect every piece of it, because that will give you the full view of how you change your business from start to finish.
Right, as a matter of fact, you might see something in there, there's a difference between taking something that someone else has used,
Right.
but then really making it your own, and you might see one of those angles that you can shift to perhaps a different way of doing things that may in fact give you the competitive advantage, because they're clearly, these business models are always evolving.
Hi, my name is Stuti, and I work for Optra. We create artificial intelligence technologies and core engines to drive data generation forward in the spaces of health sciences and healthcare. And my question for you was, I was at the panel yesterday here as well, and there's always this thing where business models are constantly changing for the improvement of your business. But you mentioned something really interesting, that there's always somebody somewhere that may be that limiting factor in your business, and we have to recognize that. So I've talked to a lot of entrepreneurs and companies, and I always ask one thing, like, do you guys incorporate a Six Sigma strategy in your business model? Because I think it's very important, and at some point, in your business, you realize that you have to find where you need to improve. And my question for you is, do you incorporate that sort of early on, and what are your thoughts on incorporating a Six Sigma strategy as a business model as for an entrepreneur?
I think I like the concept in the sense of, finding where your weak spots are, which I think we probably do it a lot intuitively without maybe doing the formal process. You look at, okay, where's the trouble spot? Where's your product not getting to market because of some reason? And then you work on figuring out root cause and generating alternatives. So I think a lot of times, especially in a startup, some things are done a little more ad hoc than formally, but I think it's a great way to think about how to analyze where you're stuck. Because if you just keep getting stuck and doing it over and over again, you usually don't have the resources to be able to go through too many iterations without finding
And the
answer.
time, right? I mean, Six
time.
Sigma is,
Yeah, time is money.
a formal Six Sigma process is not short.
Short, yeah.
Yeah.
Okay.
I was just going to say, I don't know how many of you got to listen to Jyoti Bansal speak. Great story, and it's obviously a great outcome. But Jyoti actually, when he was talking about his journey, and he talks about going from $5 to $10 million in revenue, he talked about one key aspect of his business that he was focused on. And I think all of these things are important. Believe me, we think about them too. But right now, as a company, you are focused on one thing only, which is product market fit. Once you have product market fit, then you can invest in all these things, because now you know where you're going to invest and become better and go from 10 to 70 to 80 million. But until you get there, you have to stay focused on making your business hum. And I think that's really the key that I'd encourage every entrepreneur to do. We're in that phase right now. I want to go and invest in all these amazing practices that exist, but we know right now we're still trying to find the right product market fit.
So I'll add slightly to what Ankur actually mentioned with a slight modification to that. My background is actually in continuous quality improvement. I understand Six Sigma, Lean, all of them, right? If you don't measure it, you cannot improve upon it, right?
Exactly.
So the bottom line is, no matter what, with every company that we interact with, we enforce a discipline for certain KPMs, key performance metrics. Whether it is in finance, whether it is in sales, whether it is in marketing, engineering. So in engineering, what is the velocity of the sprints that we basically do? We measure that. It's only if we can measure it can we actually go ahead and further improve upon it, or actually understand what the gaps might be that we might need to act upon. So it might not be Six Sigma or formalize as Six Sigma, because that actually comes later. But you do need to have certain metrics that you need to have a discipline. And if anybody is interested, we have a stack of those metrics that we actually advocate for companies to actually monitor and report upon in a diligent fashion every month, and discuss it with their management team in a very transparent manner.
Thank you.
So summary I'm hearing is that the concepts of Six Sigma are applied either intuitively or with a smaller
Discipline.
subset of very focused metrics. But laser focus is an absolute key to success of a startup.
Absolutely.
This is Ramki here. We're working on a SaaS platform for enterprises. Right? So there was a question about pricing earlier, right? So just a similar question. How do you price a SaaS platform when you are taking it to a large enterprises, right? Like it's a new market. There's no competition to look at. But purely a SaaS-based platform, it can become a hybrid later. But how do you price it? What are the parameters to look at?
Let me take that question briefly. I'll go back to the company that I actually founded and started, right? It's a company that's called Quantros. We introduced the first SaaS-based monitoring platform for patient safety, and it was an enterprise-wide platform for hospitals. Believe it or not, there was no model for that. There was nothing. Nobody had introduced a solution like that in the market. We didn't know how to price it. We actually worked very, very collaboratively with our hospitals. And there were economics to basically literally indicate that, hey, if you help hospitals monitor some of all of this data and they're able to mitigate risk or identify how they can act upon some of the risks that might be inherent within their system and plug those, they would save a ton of money. You know, a hospital-acquired infection costs them money. If a patient falls, the extended stay costs that hospital money. So based upon some of those economics, we actually landed up with a cost to introduce to the client. But believe it or not, for a period of time before we stabilized, it was, you know, what the client could basically afford to pay, and we were basically gauging and not going below a particular threshold that we had internally set for ourselves.
If I may ask a question, how is it product consumed? Is it consumed on a per user basis, or how is?
It's not a per user product, more of an enterprise product. There could be users, but I don't think it can be
So while you
cost.
figure out sort of the strategy, you want to show something to the customer, and it sounds like you're pretty early in your journey, but you're still figuring it out. The pricing question does come in, and if you want to have something there, I always recommend having sort of a pricing model that shows a per user license metric, and then a services model associated with it, just to kind of get you in the door to make sure that you're there. And eventually, if you want to work with the customer to understand what you can tweak, make sure you do that. The reason why I say the user model works is because the user model allows you to grab land, and then eventually, as they continue to get more users, you'll continue to see that increase in the model as well. So it gives you a nice metric to start off with, but eventually I would ask you to figure out what is the one mechanism that you're really monetizing on, and figure out what is that licensing metric that makes sense.
Identify some units which you can measure.
If you want to talk about it.
And there's one other factor that you might want to take into consideration. For a lot of the kind of products that perhaps the audience works on, they rely upon somebody else to actually introduce it to a customer. So have you built in that particular margin into that particular model for your pricing?
Thank you.
Well, and I think the other thing, we've talked a couple of times here about pricing, is, I think you really have to work hard on the value piece of it.
Yep.
Right.
Really understanding who is getting value from what you're doing, and work on quantifying that. And I think then really going out and doing the market research with these people that you think you're giving value to have them, give you feedback on where they monetize the value. And I think out of that, sometimes you find out the value is even someone else besides who you think you're going to be selling to. I mean, I think that's so important to do that early on. That's going to help tell you whether you even have a business or not, is really where that value is.
And value is seen by the customers, not by you. Right?
Yeah, no, that's right. I mean, they'll tell you.
And you may underprice it to get into the market, but you have to be very clear about, are you buying the market share, or are you now truly selling to the value of your offering?
Thank you.
My name is Anand Iyer, and I'm with SKUMagic. And we basically are transforming an enterprise app into a SaaS platform. Okay. We've successfully done that. But there's two components. One is the instant, you jump in and sign up, you see something going. The other one requires a little setup, just like any enterprise. And Salesforce has handled it really well. Do you have any ideas on business models where you can bring in the service component, where it takes a couple of days to set it up so that they can use it and consume it in a SaaS format? But that setup is where the hurdle is, and it's individualistic that way, just like Salesforce is, right? So how do you handle something like that?
I don't know what the other two panelists will say, but in our business, I mean, we always charge for a fee.
Pilot,
Well, if it's a pilot, we do sometimes charge for the pilot, but even during a particular sale in the contract, it's built in for setup, implementation, and training fees. Training fees are actually separate, setup and implementation is separate, and then there's the licensing cost. Especially in an enterprise-wide situation, depending upon how the application is rolled out and how many users are there, the training could get quite expensive if you were to bundle it into your licensing costs. So we always separate it out.
Right, and the other part is if they're not willing to invest something, you could put a lot of work
Yes.
into something that they're
Yes.
not going to follow through on.
Yes,
They need some skin in the game.
yes. And mind you, enterprises are used to that model.
Right.
Yeah, in fact, in some markets, some enterprises, if you do something for free,
Yeah.
you are dropping your value. They will think something is not right here.
Right.
Actually, that's a great point. If you're doing a lot of stuff for free, you'll find that if you're not qualifying the opportunity up front and kind of extrapolating those dollars, you're basically building a product, and they're learning on your dime, right? And they may not consume that product, but now they've learned everything about it, right? So that's a pretty big risk to kind of avoid. By getting them to invest in the pilot, or actually even to pay for the setup fee up front, you're getting them to put some skin in the game, right? Which actually could basically fund that setup itself.
I really, really advocate people not do just free pilots, okay? There's nothing like a free pilot. Trust me, you're not going to sign that contract for a long, long time. You'll keep on doing pilot upon pilot.
My name is Karun. Me and my partner in the crowd, we are working on a novel method to deliver drug, compared to the conventional method. We know what is the cost structure for the conventional method, and the novel method is going to save cost, time, and post-drug administration complications as well. So now the question is, should we, okay, considering the total number of, let us say, administrations over a period of time, if our drug is going to replace X number of administrations over some time, then at least our drug can be sold at a cumulative cost of number of administrations given to the patient at that time. Okay. However, we don't want to do that. In order to capture the market, we want to be lower than that. Plus, we have a value add on the fact that the patient does not have to undergo complications, because every time a drug is administered, there are side effects, complications, and infections, etc. How do we include this value proposition into the cost structure? How do we optimize the cost? We don't want to overshoot the cost. At the same time, we don't want to undercost ourselves just to gain market entry. What are your thoughts? Appreciate it.
I don't have much experience, by the way, with drug pricing or drug models. I have better experience with software and how we introduce software into the market. But my guidance to you would be to basically look at other models. I'm sure that there are parallels to basically what you're doing in drug administration in some other areas as well, right? In terms of other therapeutic lines that might have done that, meaning that they were the conventional. So I'll give you a very, very good example. I know of a very young entrepreneur. He's not part of our accelerator, but a great entrepreneur. He actually presented at the TIE 50 and won the award yesterday. His name is Ashwin. The traditional way of doing an EEG, an electroencephalogram of your brain, is basically bringing you in and wiring you up and basically literally spending a ton of time and a lot of specialists to basically take that EEG and then to interpret it. He's literally created a sort of like a device that actually has all the electrodes, and now literally made it as a procedure that literally can be done in the doctor's office, requiring hardly any specialist, and the time is condensed, and the procedure codes for reimbursement are the same.
Yeah, that's key.
Right? So that's what you have to look at. So if you think that your technology qualifies for the same the same reimbursement code that was basically being applied before, there's nothing that you need to do to price differently. You're going to get the same pricing of your drug therapy as the other conventional therapy, but you're going to be able to provide more, and the complications are that much less, right? I can just give you an analogy like that, but I can't give you a very specific answer to what you are facing.
Okay, yeah. Some of the other previous efforts in similar kind of, okay, in your EKG example, he's doing it, the new device is saving effort, time, and possibly maintaining the same accuracy or even better accuracy as before. So in that case, how would you recommend he adds value of this reduced cost, reduced effort, and convenience?
Well, he's not. See, the code, in the US at least, we are paid by procedure code.
Correct.
Right? So that EEG code that today the hospital is charging, it costs them that much more to do that procedure. By basically using his device, they're going to get paid the same amount of money, or the doctor is going to get paid the same amount of money, but it's going to cost them that much less to actually do the procedure. So they save more. So the hospital is actually making more money.
Yeah, I mean, in this case, I think you have to look at who's paying for the device and how much are they getting paid. You know, in your case, if it's a drug, then it's either the payer is paying for it or the patient has to pay out of pocket. So you really have to figure out, they're the ones that are going to decide ultimately whether they're going to approve it.
Yeah, for 5 injections, each of $100, say the reimbursement, the doctor will get $500.
Right.
But now, with our solution, it's only going to be 1 injection, and over the same period of time. So the question would be, okay, we are replacing injections worth of $500. Can we sell it at $500? Or can we sell it at
So actually, the only
As a
question.
sales guy, I say yes. So
No, but in healthcare, it's not as simple as that.
It's who pays.
What-
though.
Yes,
Yeah, you
it's
have to know
actually
who's
who
paying
pays.
that money. Is the doctor paying for it, or the patient, or the payer?
The insurance.
Well, then there's a code
Yes.
for it.
Yeah, we have the reimbursement code.
So that's it. Then the code decides what you get paid.
But the
Okay.
doctor may decide, if they like the idea that they only have to give one injection, they may choose to recommend it. In many cases, the doctors recommend, what's actually
Yeah.
going to be used.
In this case, the insurance money comes to the doctor,
Yeah.
but the drug is sold by us.
Yes.
So the drug, what the doctor was previously, let us say, for every $100 injection, he was paying $50, let us say. So his markup was $50 per injection. So for 5 injections, he's saving $250 with 5 injections. Now, our injection is going to be, should it be with the same markup for the doctor or
Well,
less?
I think it's fundamentally what the market is going to bear. You should maximize your profit completely. So,
Well,
Yeah.
right. Yeah, but the other
I'm a
thing.
sales guy as well, so.
Yeah, but the other thing you really have to look at is the doctor getting to have 5 visits and making money off of each one of those visits?
Correct.
About the
That's not
value
the
that
correct.
Patti
Then
talked
you
about
really need to
earlier.
be talking to the doctor and
All right,
ask
we
getting their
should-
idea.
About the value again.
Yeah, it's the
thank you
whole
very much.
thing.
So I think that
Thank you.
Good afternoon. My name is Ravi Mangapudi, and I'm a CEO for a SaaS-based audit operations excellence solution. I worked in the field for 30 years, and I've used a lot of those tools, existing tools, and so we're trying to find a niche in the white space there. Interesting situation here is, and as you talk to the customer, and we acquired our first customer just 2 months ago, and by the way, we're also Thai 50 winner last night, so I'm excited about that. The question I have is this. When you talk to the customers, what we're finding out is that pricing seems to be the least of their worries.
Good.
Operating effectiveness, in other words, if you do not report and get your projects done by a certain time and don't report it to the board, you're probably going to lose your job. So what's value is your job, becomes the pricing in a way. Okay, so when I asked like one of the large companies in Colorado, I'm from Denver, I said, where does pricing fit in your scheme of things in priority? They said it's number 3. What is number 1? It needs to work. It just needs to work so I don't get fired. They don't say the second part, but I know that. So how do you operate in a situation like that where you don't want to go crazy, but you have leverage here?
So, one of the things. So I started my sales career at Oracle, and one of the things we used to do was something called the Insight. We used to do basically an evaluation of the customer's business, and we would identify the problem that they were running into. And if you guys aren't familiar with the concept of MEDDIC, it's a concept that exists, and I would highly recommend go look it up. It's MEDDIC. Those are the acronyms, but the M stands for metric. And one of the metrics that you have to figure out is what is this problem costing the company? Or what is that metric that they're trying to change? And the reason why I say that is because if we were talking to a company and we found out that this business problem was costing them $10 million a quarter because they couldn't close their books, then we knew that we had a pretty sizable deal on our hand, because even if we came back with $1 million quote, we could justify the ROI because they would recoup that within X. So I would strongly say instead of finding out what is that job piece, find out what is the problem costing that particular company, and qualify that a little bit more, and then come back and try to back into that number using some variables that actually help them solve that problem. That's been a pretty big thing, and today within sales organizations, we always try to find that metric over and over so we can quantify and try to back the deal size into it.
Even when it's a little bit difficult to do that, there's no established models for that, and you just need to figure this out.
I would say there are practice directors, a lot of the folks that exist today. If you look at something called Insight Directors on LinkedIn, they exist. IBM has them, Oracle has them, and their fundamental job is to make the business owner or the problem owner think about how to quantify that problem, and then to actually back into what is that actually resulting in terms of the actual cost by not solving that problem. If you're really going down that path already, which it sounds like you are, it's a good thing to invest in, because you can actually get a pretty sizable deal out of it at the end of the day. And the customer actually gets to see what the value is of your product and how big of a problem you're solving for them.
Right. Thank you.
So we are out of time, but I want to, since many of the questions were about pricing, it just reminded me of a dialogue I had with my son. So I'll leave you with that thought. So he was in his middle school, and he wanted to be an entrepreneur. I want to show that he could make some money too. So somehow he had this is about 15, 20 years ago, this thing called Rings of Friends on web, and he He would buy products, Sega Genesis products from Japan, from his friends, and those were not available in the US. They'd have them shipped here and then sell them on eBay. And he made $2,000 in his middle school, which was a lot of money for him. But he came to me one day and said, Dad, I'm feeling so guilty. You know, I'm buying this thing for like $20 and I'm selling them for $40. That's 100% margin. Isn't that too high? I said, son, pricing should never be based on cost. It should be based on what market can bear. Right. So with that, I'd like you to join me in thanking our panelists.
Thank you.